And good morning, everybody. This is Panos Mumsis. I'm your facilitator for this afternoon session of this webinar. I'm with the Transformative Agenda. I'd like to say a warm welcome to all of you. I can see we have a number of colleagues who have joined us from North America, Africa, Middle East, Asia. So really great to have so many humanitarian actors, both from UN and NGO colleagues with us in today's webinar. Before entering into the subject and the topic for today's discussion, I would like to explain a little bit first about the webinar setup. As you can see on your screen, on the top right-hand side, you have 4 different boxes: participants, chat, Q&A, and polling. A polling has already opened, asking you some information about where you are in your experience. As soon as we go through the webinar, I would like to ask you all, first of all, to be on mute throughout the webinar. Secondly, please disconnect your video camera. This is really an audio only, so make sure your video is not active. Also, I would like to point out to the questions box. Now, while webinar, from the get-go, I would like to encourage you to send questions to the Q box. Sorry, I can see. I would like to ask you to take questions through the Q&A, to send the questions to the Q&A box. I would also like to encourage you to use the chat box and to not hesitate to chat in between yourselves. You can communicate, share information, share messages. You can send messages to the presenters or to all the participants as we go through. So this webinar is 90 minutes long, and the first 45 minutes I will be asking the participants, the speakers, each a couple of questions, really just to get the conversation going and to explain a little bit more about today's topic. Now, on the second 45 minutes, I will take questions that you will send to us and ask them to the participants. So we will be delighted to receive questions specific to your situation, and we will be picking up the brains of the participants in terms of what they think and how they would like to go about. Today's topic is really about the use of cash. Cash is, of course, becoming more and more significant in emergency operations. Cash is really a way to maintain the dignity of the people, to give the beneficiaries, the people we're trying to help, to give them a choice. It appears as a much more sensible way of supporting people in need. It stimulates local economy and markets. It gets people back on the feet and functioning in the normal way of life. It gets assistance to people that need it in a quick way. It has also a significant cost saving. It cuts out the middle person. It avoids logistical and transport costs. And it puts really a much more emphasis on the private sector and the market to be able to support supply and demand for assistance. I think we all agree it's simple, it's convenient, but really, is it right for every situation? What are the drawbacks? What are the pitfalls? What should everybody know or be aware of, in particular on the use of cash? And as we go with cash, of course, there are many actors. What do the government, the host governments, what about the local authorities think about it? How to engage them and how to make it in a way that adds the efficiency and effectiveness of the humanitarian operation. To answer all these questions, we have with us 5 distinguished speakers that I'm delighted to introduce, and I'm really appreciative for the fact that they made themselves available to share their reflections and the best practices. I've asked all speakers to be as practical, as field-oriented as they can in their presentations, and to give ample of examples on how they use cash. The point of this webinar is to inspire you, to give enough best practice and information to all of you listening to be able to take it forward to your own operation. I'd like now to present the speakers. I'm going to start with Rosie Jackson, who works with the Cash Learning Partnership, CALP. She's joining this conversation from Oxford in the UK.
and she'll be sharing the experience from the CAL perspective, the NGO practitioners who use the cash. The next speaker I would like to present is Jamie McColdrick. Jamie is the humanitarian coordinator. He's in Nepal, in Kathmandu, and is joining us live from Kathmandu. Welcome, and great to have you, Jamie, with us. The third speaker is Rita Dakkal. Rita is the regional head for the humanitarian response, working with the Danish Church Aid. She's also right now speaking also in her capacity as a representative for the Association of International NGOs in Nepal, also joining us from Kathmandu. Welcome, Rita. The fourth speaker is Peter Magici. Peter is the Regional Director for Health Age International. He's also presenting from Kathmandu, Nepal, so getting and also the NGO perspective in terms of the use of cash in Nepal. As you see, we have three speakers joining us from Nepal, and a lot of the focus of today's webinar is going to be on the best use and how we went with the operation in Nepal following the earthquake. And the last speaker, but not least, is Tim Waits. Tim is the Senior Livelihoods and Disaster Resilience Advisor. He works with DFID, the UK government. He's based and joining us on this live webinar from London. So really a warm welcome to all of you. I'd like actually to go first to Rosie in Oxford, working with the Cash Learning Partnership Organization. And I wanted to ask you actually, Rosie, first of all, can you tell us two words about CAL? What is exactly, what's your organization working on? And then we'll be really interested to hear about what are the cash options and the modalities for colleagues in the field to consider when they try to apply their operations cash. So, Rosie, over to you.
Great, thanks very much, Panos. So, just to start with, I think it will come up on your screen. So we are the Cash Learning Partnership. A lot of people will be familiar with the organization. We're a group of, a collective really of 5,000 individuals from 150 organizations, but it's completely open. You can have access to information that we share. We've been working for over a decade on issues around research, around capacity building, and coordination as well. Within the sector. There's going to be some information that's coming up on the screen in terms of how you can have access to this, but all of our information is open source. So I wanted just to start by answering that first question, Panos, around what is cash. So there is a definition that will be up on your screen just now, and this is something that's from SPHERE 2011, and it reads, cash and voucher transfers are used to meet basic food and non-food needs, or to purchase assets enabling people to resume economic activity. So loosely, cash can be used as a tool to ensure access to goods and services. Simply put, if it's possible to buy a good or service in the adequate quantity and quality, then it's possible to use cash. It's really as simple as that. It's providing that people are able to access markets. So I think typically, and we often hear this, if it's designed as part of a well-designed program, then cash assistance can offer choice and flexibility, something you often hear, to affected populations in a manner in which decisions are respected and dignity is reinforced. The next slide that we'll come on to is just covering off some of these terminologies that you see often within programs, within cash-based interventions, and when we're talking about it. So just at the top there, you see cash transfers and vouchers. So cash transfers would often or usually offer a bit more flexibility to recipient households than vouchers, where vouchers would be a bit more restrictive in their nature. Typically, for example, you might recommend a voucher if you are determined around your desired outcome, or where markets might need to know their specific demand, and we'll come on to talk about that. But this might be the case in market recovery post-earthquake, for example, or in a context that demands a system in which spend is more easily traced. Coming on to the next tier, you'll see here issues of conditionality or restriction, referring to prerequisites or utilization that people might have around the design of the cash transfer. So if a cash transfer is conditional, this refers to something that the recipient is required to do prior to receiving the cash, and if it's unconditional, then this isn't necessary. So an example of a condition might be that households are required to send their children to school prior to being eligible for a cash transfer, or that work is required. So these are cash for work programs that you see. So the restriction or utilisation discusses the way in which recipients are entitled to spend their money once it's received. So unrestricted means that people are able to spend their money on any good or service. So this could be any commodity or savings or debt repayment, for example, and a restricted grant or voucher would need to be spent on something specific like nutritional goods or shelter, for example. The final layer here starts to look at some of the multi-sector developments in cash transfers that have been happening over recent years, and many of you will be familiar with this and hearing about it in your context. Much of the policy and programming is in its early days, but the difference at this point is typically in the intended purpose of the grant and the outcomes on which it will be monitored. And this requires a lot more multi-sector programming and join up along the program cycle. Back to you, Panos.
Thanks, Rosie. Having worked as a cash learning partnership or CALP on cash for the last 10 years, so you really have accumulated a lot of experience from the various organizations that are part of your network. So can I ask you, what are the pros and cons of cash assistance? Is it really all positives? Are there issues that we need to be wary of as something as humanitarian actors? Can you share your reflections on the pros and cons for colleagues in the field to know? Over to you.
Sure, great. I mean, I think on the next slide, we've actually summarised some of these sort of regularly discussed pros and cons around the considerations of cash transfer. And these are things that we need to take into account when we're looking at, can we do cash, for example, or should we do cash, which are some of the obviously critical questions. So if you start with the ones next to the green arrow, these are the perceived or assumed pros. So you have security there, choice, economic integration and shared reliance and dignity, some of these things that are associated with the flexibility of cash. And then there's accountability to donors and inclusion. But some of the risks and challenges are also outlined at the top there next to the red arrow. And you can see that some of these actually contradict some of the pros. So where you have exclusion on one of the negatives, inclusion is deemed as one of the pros. And accountability to donors, for example, versus on the negative side, this increased or perceived increased risk of fraud and diversion. So you can see that the challenges in cash are both on the ones that it poses. So, for example, there is a perception that because it's very attractive, that cash might increase conflict within communities or households. But the challenges are inherent in those that it exposes within our system. So, for example, typical weaknesses that we understand already around targeting and joint planning. But if you loosely start to unpack these, then you can see the means by which we can capitalise on opportunities and mitigate those risks. Back to you.
Thanks, Rosie. Can I ask you, like in our daily work in operations where we try to do everything around the humanitarian program cycle, how does cash fit in the cycle? When do we start and how do we go about incorporating it within the operation? Over to you.
Great, thank you. So I think what we've put up on the screen, on this one here, so you can see this is a program cycle of sorts. This is something that people listening in today would be very familiar with, and this is because there's not really any particularly additional steps necessary for cash transfers, but rather it's the systematic inclusion of information along the decision-making process. So obviously there are some different things that you need to consider. First of all, when you're looking at the quality of your needs analysis and vulnerability assessment, cash can be used for anything. So this exposes potentially some of the weaknesses and assumptions that we're making in program design. It becomes very important to understand how people make their money, how people save and spend their money, for example. And this would be critical to understanding your expected income. So really, if we're not giving enough cash, for example, and our assumed priority turns out to not be the same as the priorities of affected communities, we might see some problems with our outcome, and obviously you can start to support that with additional capacity. In addition to that, throughout the program cycle, there's considerations like you can see here, markets and financial service providers and delivery agents and technology. These are things that we're not always so familiar with. But markets, it's very important to understand, make sure that markets can provide access to the right commodities and services at the right time, at the right price, and in the right quality and quantity. So these are questions we're not always familiar with. Financial service providers, it's critically important that they're able to deliver cash in the necessary volume and speed, and they're able to adequately account for this. And understanding technology, this is new to lots of us, but there's opportunities within there that are also very important. All of this comes down to internal capacity, really, which is a critical consideration. And until organisations and institutions have the systems and processes and human resource capacity to deliver cash as a component, the extra significance and effort should be given to this area. Back to you, Panos.
Thank you. Thanks, Rosie. I'd like to, before actually moving into the next panelist, Warren Kathmandu, I really want to encourage you all to use the questions box, which you'll find on the top right-hand side of your screen, and encourage you to send us questions, which I will be taking in about 15 minutes past the hour. I also want to encourage you to use the chat box. Don't hesitate to talk between yourself and the team to write and share practices and experiences of where you are and what you're doing. I'm now going to take us all to Kathmandu, and I'd like to first go to Jamie McColdrick, who is the Humanitarian Coordinator. And Jamie, welcome. Good to have you with us online. I'd like to ask you, in the Nepal operation, the humanitarian response following the earthquake, how was cash used? What was the government role? Can you walk us through your experience of having put to use the use of cash in this humanitarian response, and how it has worked for you as the actors on the ground? So, Jamie, over to you.
Okay, Panos, thanks a lot. Maybe just to describe the context. The earthquake happened during a time of political transition in Nepal. There was a coalition government which was grappling with trying to put a constitution together. The two earthquakes that struck actually had an overwhelming impact on the bureaucracy, the systems, including preparedness in the capital and the earthquake areas. Early on, the humanitarians acknowledged the importance of cash in the earthquake response because of the logistical and topographical challenges of reaching, a lot of the affected populations were in the very high, remote, high-altitude locations. But in this country, there's been a long history of cash programming during the conflict and the post-conflict, up to 2005, and also social security schemes that are around in the mid-90s. Overseas remittances in this country make up some 30% or a third of the Nepal GDP. Migration occurs from many remote areas in this country. There's like 400,000 migrants leave this country every year to work in the Gulf and elsewhere and send their money back. There's been ongoing price and marketing monitoring by WFP over the years. And you'll see on the screen all the images of what's happening in Nepal, the earthquake response, the urban and rural communities, the affected population, how we've had to use the distribution of commodities through using mobile technology, different systems of banking and remittance, as well as different types of logistical support, Sherpas and mule trains and jeeps. What we did was we used 10% of the response we've calculated was in cash form. And we recognise that the findings and recommendations of the high-level panel report was mentioned that 6% was the global average, so we're above that. And the questions we're asking ourselves, how to scale up cash and secure the next time a much better performance in that, and protect and preserve the logistic infrastructure, at the same time able to deliver to the very isolated communities. Cash was recognised in the strategic appeal, the objectives of the flash appeal, as a support to the objectives towards recovery and resilience very early on. No targets were set for populations in those appeals because at that time it was very difficult because each cluster had to work out the geographical area which they would be most appropriate in terms of forms of assistance, looking at market functionality, access and programme objectives. But at the same time, I think we're quite pleased with the fact that 10% so far has been given out, which represents about $25 million. And that's been sort of broken into three areas of cash granting. One was multi-sectoral unconditional grants, and that was given to some 430,000 people. and there'll be more will happen between now and the end of November. Sectoral early recovery, food security and shelter got cash vouchers and cash for work. And UNICEF had a top-up scheme on existing social programs where they linked it to the humanitarian and the long-term protection through the back of the earthquake. And the government themselves have put out some 70 million as part of that as well, cash for shelter support, death compensation, food, etc. Because of the remittances that happen in this country, there's large networks of personal remittance distribution schemes. There's long-term social cash distribution. But the financial service providers here at the time of the earthquake faced liquidity challenges. Their coverage geographically was quite difficult and quite low range. At the same time, I think recovering themselves from the impact of the earthquake. And I think what we're trying to do now is to see how we could use this to expand that network. The country right now has about 30% coverage of banking services, which has expanded quite rapidly over the last years. And, you know, the population themselves, many of them have no access to these functioning financial service providers. And even in this country, many people don't have citizenship papers and therefore can't access bank accounts or mobile phones even. And this, I think, has had an impact on the delays on the cash programming as NGOs and others try to identify good financial providers that could work in these identified geographical areas which they weren't present before. The UN Capital Fund had mapped out previously a sort of spread or a footprint of what limited agents were working in these areas. And even though they were there, they were very unaccustomed to managing large volumes of cash. And the government themselves actually put in some restrictions on the cash agencies could take from banks at any one time. But that said, I think the banking sector was very responsive. They broke rules and regulations, agreements with travel to areas they hadn't worked before. We used a company called Hello Paisa, a company offering mobile financial services linked with banks, and they'd actually expanded outside their existing branch network. A lot of the other assistance was given in the form of cash in envelopes, which was used as we flew into some of these areas by helicopter to hard-to-reach areas where markets were not functioning. And we were able to give funds to the individuals at that time. And I think that's one of the things, using contracted retailers and local cooperatives were also used to distribute cash. One of the things we grappled with was actually the coordination of it. And we established, because of the scale of the cash programming and the newness of it, the cash coordination programming group was set up, and that was supported by OCHA. It was formed within the first days of the earthquake and continues to operate in Kathmandu in the 3 operational hubs. Operational guidelines were given out on multipurpose grants, and they were produced in the first month, agreed by government and the humanitarian community. And then local communities were given responsibility for interpreting national guidelines and coordinating at district level. And the balance between national direction on cash and local decision making has been a bit of a challenge because of the timeliness and the consistent nature of the assistance. So right now we are questioning to what extent the cash coordination group managed to influence clusters, and this may be a lesson we have to learn for the future in terms of the focus and the mandate of this group and the coordinators in the clusters. As you know, the HLP, the high-level panel, recommends that cash transfers could actually break down the counterproductive divisions with the clusters. We didn't see much of that happening here in Nepal, but I think the cash coordination group and its members more operated as a sectoral type operation. I think that was something that was good to work. And also in the HLP report, doing cash differently, we need to further improve the coordination of cash transfers in the current system. One of the problems we dogged our performance here, I think, was the information on all cash transfer programming had not been properly captured throughout the response and made it very hard to ascertain the full scale of the cash footprint. I think the cash coordination group sort of wrestled with the issues of duplication and reporting. Data was not harmonized, it was not consistent across coming from the clusters. So I think the recommendation for us was the next time we have a system, we do this, we set up a system at the beginning of the response so the cash group can actually extract and analyze cash programming across. I think this would also help us to distinguish between the voucher system and other cash transfers, as was recommended by the high-level panel. And also I think this cash group should actually work less independently and be much more working across and embedded throughout all the key clusters. Not all the clusters, but the ones who use cash. So then just maybe moving on to targeting. This is not a specific issue only of cash, but also it was something we were faced with here. The government tended to use cash in this regard as compensation for loss, rather than the humanitarian principle of support according to needs. Local authorities push the idea of blanket coverage of assistance, sometimes thinking blanket coverage would be easier to program, sometimes because political pressures. But sometimes it made it very difficult to start targeting beneficiaries, especially in the recovery phase. I think some NGOs have been informed of it. They've already been told that they cannot support families that are without a government-issued victims card. And this is another problem because all victims don't have cards. And so many NGOs have faced difficulty actually reaching the right populations. And then on monitoring, from post-distribution monitoring, most unconditional cash assistance has been spent on 3 areas: shelter, labour for shelter and food. And when asked about additional cash received, beneficiaries have not been including information on the remittances that come from their overseas family members. They see this as normal income and not earthquake related. I think this has had an impact on the humanitarian community's understanding of the volume of cash to some households and how it actually addresses the basic needs and levels of vulnerability. And I think directives and information coming from central government could have been better disseminated both at district level and also within the humanitarian community. There's a lot of confusion and conflicting information there. I think all the emergency support in this country is very challenging. Nepal is a very politically charged context, and the government counterparts are always changing. There's always a turnaround. And also you should know that in the local level there's been no elections in this country at local level for 16 years, so the accountability deficit is there. And it's recommended that a strategy in targeting criteria and harmonised grants should be decided at a national level. I think we have to do that to ensure equity across the disaster-affected population. I think the harmonisation of grant sizes and conditionalities doesn't mean that everybody receives the same, but I think the grant sizes could follow pre-existed and classified principles. And right now we're trying to put out a baseline map of financial service providers, looking at the markets, the tertiary roads, and use that as a baseline map for the future. And hopefully this will help us identify where the populations can be supported in the future through any cash assistance programs. And the approximate population in these areas, the disaggregated data on vulnerabilities and risks and other areas which are important for targeting. And at the same time, look at the markets in those areas where they're able to absorb cash in that way. And I think from our side, thinking is underway to regard what kind of mechanisms of accountability and transparency would be needed if we're going to actually scale up the next time the cash part of it. And I think a lot more cash transfer program has been planned in many sectors for the recovery process, and particularly food security and livelihood supports. And cash injections are expected to lead, I think, we hope, to a more fast, efficient, effective recovery process, especially as we provide support to livelihoods and getting back to normal after the earthquake. So I'll leave it there. Over to you, Panos.
Jamie, wow, thank you so much really for walking us through the Nepal experience and the use of cash. Really your oversight going through the response, the technologies that were available, the coordination, the government oversight, the targeting and how you went about it, the monitoring, the future steps, but also the whole question of accountability and transparency as humanitarian workers and putting your own self-critique on what has worked or what could be done differently. That's really of tremendous value to all of us. I'd like to remind everybody 2 things. One, before going to Rita actually, one is please keep your microphone on mute at all times. I can still see a couple of colleagues who are not, and we can hear a little bit of background noise. And secondly, really to encourage you all to send questions as we go through. I'm now going to go to our next presenter, also joining from Kathmandu, and this is Rita Bekal. Rita is the regional head for the humanitarian response for the Danish Church Aid. She's also a representative of the Association of the International NGOs in Nepal. So Rita, I'd like to ask you, what was your experience on rolling out a cash program after the earthquake disaster in Nepal? What were the steps, what were the considerations, and how did you go about it? I know we have a lot of colleagues listening to from around the world, and they could benefit from your kind of practical step-by-step as an NGO because of how you went about to implement it. So Rita, welcome, and over to you.
Great. Thank you so much, Panos. Hello, ladies and gentlemen. I represent one of the 125 NGOs working in Nepal at the moment. The NGOs in Nepal was established in 19 years before, exactly in September. So my experience in working in cash transfer in DCA this year after the earthquake is something that I would like to proudly share with you. DCA has distributed $1.3 million using mobile phone in 4 severely affected districts by the earthquake in western and central Nepal. These districts are Gorkha, Dhading, Lalitpur, and Bhaktapur. We started our cash distribution in one of the remotest and highly affected village development committee, lowest unit of the government administrative division in Nepal. 5 weeks after the earthquake, to 148 households, reaching about 815 people on this very first day. DCA provided shelter support as initial assessment findings showed that shelter was a pressing need at that time due to the high damage of shelter and houses and impending monsoon season. DCA completed market assessment together with the members of the ACT Alliance through our local partners in all 4 districts. The survey findings showed that market was functional with small quantities of goods for reconstruction available in the local market, and these were accessible. DCA decided to go for cash as it was observed that many humanitarian actors were waiting for large quantity of corrugated galvanized iron sheets to become available before conducting distribution, while individual families were able to source small quantities of CGI sheets relatively quickly. So many households had already built and were reporting borrowing money to do so. People had a preference to receive cash over in-kind assistance. Providing cash gave freedom of choice to buy other shelter materials or to spend the money on labor costs. As one of our beneficiaries said himself, if it was CGI sheet instead of cash, I would have sold it immediately to someone, even in low price, to buy other needed things for my family, as I had managed CGI sheets already. Rambadur Tamang from Salang VDC, Dhading district. We decided to use mobile phone-based cash transfer, having already tried it successfully in response to a fire disaster in eastern Nepal in early 2015, the first time this had been used in Nepal. This system provides transparency and security. Remote and real-time monitoring was possible for senior managers, among others. We also wish to involve private sector, banks and financial service providers, and telecom company in this case. In this case, in humanitarian action and build relation for future private-public partnership for longer-term programming as well. It was an efficient way of doing cash, as we distributed to as high as 1,476 households that benefited more than 8,000 people per day once we launched efficiency over the time. To ensure community members had enough information to make good purchasing decisions about shelter materials, quality CGI sheet, for example, we provided information alongside the government. We also provided a list of reliable vendors to the communities. The longer-term presence of our local implementing partners in these communities helped us to get access to the affected area quickly and rapidly build trust and scale up operations. This helped us to make agreement with local authorities to operate in the area. We were able to access government beneficiaries' data and compare with our own. We also mobilized 80 government officials from 9 village development committees and 4 municipalities to support the cash distribution work. Beneficiaries were selected based on the government list of earthquake-affected households. As our humanitarian coordinator just said, it was not possible to specially target in the initial time. People were informed by the social mobilizers, community volunteers, and village political mechanism about where and when to access the assistance. The recent post-distribution monitoring showed most people walked about an hour from their home to reach the cash distribution point, as there were multiple distribution sites established in one village development committee. The PDM also showed 92% of people used cash on shelter construction and associated labor costs, supporting DCA's decision to provide cash for shelter. In normal days, many men go abroad for work, and women become the head of the household in these village development committees. However, after the earthquake, few men return home to be with their families in difficult times. Because of the need to use the government beneficiary list, it was a challenge to target specifically women for this assistance at that time. However, because of the high rate of men working abroad, 29% cash went to the women's hand, whereas 71% cash went to men. We had few challenges as well. Local political interest, targeting, and lack of proper understanding of large-scale cash transfer in emergency at various levels were among the challenges faced in the initial days. Thank you so much, and over to you, Panos.
Rita, well, thank you to you and your organization and for the amazing work really going out with the use of cash and walking us through the modalities, the beneficiaries. You talked about the women, about the challenges, and the connections with all actors in order to better target and to result in better efficiency. I'm going actually to move now to Peter Magici, who's the Regional Director for H Health International, who's also joining us from Kathmandu. And Peter, I understand that Health H International was actually one of the first organizations who within days, within 2 weeks of the earthquake, you were already out in operation, handing out cash, targeting vulnerable people, and doing your utmost best to reach people who were in a desperate situation. So, Peter, can you guide us, walk us through a little bit, how did you go about to put in place such a plan, and what was your experience with the use of cash in the Nepal response, working with Health H International? So, Peter, over to you.
Yeah, thanks, Panos. Hi, everybody. Yeah, I think we were one of those organisations that wasn't able just to bring our plan off the shelf and implement it. We didn't have such a plan. We are a fairly young organisation in Nepal, and our team here hadn't a great deal of humanitarian experience. But I think what we did have was experience within our organisation and very good partners and contacts within Nepal, which allowed us to move quite swiftly after the quake happened on the 25th of April. So we brought in a very experienced colleague from our humanitarian team in our London headquarters and kind of matched him up with our local staff and with a number of our existing and a few new partners that we managed to pull in within the first kind of 7 to 10 days. So I think we knew what we had a certain amount of expertise we could draw on, but we also knew what we didn't know, but we knew where we could get that information and get that support and mobilise it, put it together quite quickly. So as you said, we were fortunate that we were able to get out the first unconditional cash transfers targeting older people within the first 2 weeks of the emergency. And on the 8th of May, we managed to reach about 2,100 older people with a cash grant of $75 US. I think there were a number of reasons, practical reasons, that made a cash transfer approach appropriate for our organisation and hopefully appropriate for the beneficiaries. I think if you consider what would the alternative have been, it would have been procuring and transporting, distributing a whole load of commodities all over the place, even assuming that those commodities were available, which probably they weren't in great bulk and easily obtainable in a short notice. And our organisation wasn't one that was kind of set up to do that kind of work anyway. So I think a cash transfer was, in comparison, a simpler and a quicker approach, and it would allow us to move in a way that was more appropriate to meet those needs of older people. I'd just like to say also that I think perhaps cash transfers are a good alternative in the mix, especially for vulnerable groups like older people or perhaps people with disabilities. Because again, I think there's a lot of evidence that perhaps with commodity distributions, older people may get kind of pushed aside. Disabled people might not be able to turn up for a distribution of goods or commodities. We're also talking about probably sacks of food or other materials which have to be transported by foot, sometimes long distances, not an ideal option for an older person or a disabled person. So, and we don't want older people to be standing around for hours in a queue, perhaps in a not very inclement weather, when we could easily organise, or more easily organise and control safely a distribution of cash in a way that would also be provide more protection and security for the beneficiaries. So I think there are a number of practical benefits of looking at this approach, and which did actually work quite well in our experience in Nepal. Just to say also that in terms of vulnerability, older people are very much in that category, although at times from the protection perspective they're sometimes overlooked. I think we found that a lot of the focus on the protection cluster tended to be on, rightly so, you know, children, infants, pregnant and lactating mums, rather than older people and disabled people. And just to give an illustration of the vulnerability of older people, there are about 8% of the population in Nepal are older people over 60 years of age, but we analysed the fatalities of the earthquake. There were just under 10,000 people who lost their lives. Almost 30% of those people were older people. So it kind of illustrates that we're talking about a particularly vulnerable group where cash transfer might be, as we said, an appropriate response. I'd also like to say a few words as well beyond the kind of technical elements of cash as a good tool in such circumstances, is also the issue around the kind of local political dynamic, which I think has been touched on generally by the other speakers. We found it very important to have good local partners who knew the local kind of political environment and architecture. They knew who they had to talk to. They knew the relationships that they had to broker and who they had to negotiate with to get the permission and the approval and the support to do this work at the field level. And I had to say that they did an excellent job, but also that the work that we did would not have been possible without a lot of collaboration and support from the government as well. Jamie mentioned the cash coordination group, which we also were in touch with at an early stage as that started to emerge. We took advice and counsel from there as well. So we had our feelers out to make sure that what we were doing was within the general kind of remit that we had, but also what the general body of organisations responding to the earthquake were actually doing in terms of cash. We found that very useful, very important, and also helped us to also gain a little bit of credibility, I think, for what we were planning to do, and a bit of reassurance that we were taking the right steps. So just quickly running on to a few of the learning points. As I said, getting local partners on board to have the local knowledge and access to decision makers was very important. We did work and partner with the private sector. Initial distributions we did cash, direct cash and envelope, but we quickly moved over to working with a local bank who had an extensive network of agents in the districts and the VDCs we were working in. So they took over the responsibility for bulk cash transfer to the distribution points, and also acted as a teller during the distributions themselves. So that once the paperwork and the validation and verification of the beneficiaries had been done, they went to a desk where they collected their money from a representative of the bank or the local agent of the bank. So we found that a very useful way to work. We did, like others do, some post-distribution monitoring, and that showed that a range of goods and services that older people had managed to access with the funds. That included things like healthcare, medicine, food, shelter materials, and also paying for labour to help in putting up some temporary shelter or some kind of repair of the damaged house that they had. I think the other lesson was around, again, the preparedness element of this. I think while we were able to move quickly, I think it would have been better if we'd been more prepared. And as Jamie and others have said, I think there's a lot of learning that's come out of this experience that should help us to do that from now on. And I think my last point is around, I think that just the fact that, as I say, we couldn't have done this as quickly as we did do if we had taken another approach. So cash for us, I think, was the most appropriate thing we could do. 90-odd% of the older people that we talked to afterwards said that they were very happy with that approach. It gave them a freedom to take decisions on their own priorities that otherwise they wouldn't have done. So from our perspective, it was extremely successful, and like others now, we are including a cash component in some of the shelter recovery work that we've already started to do. So there will be a component of provision of shelter materials and a cash component to help to pay for labour to construct the shelter and perhaps to provide some winterisation of the shelter once it's constructed. So yeah, a very good learning experience for us, and I think it was quite an appropriate approach that we adopted in the circumstances. So thanks, and back to you, Panos.
Thank you, Peter, for sharing this experience, and wonderful to hear. Over 94% of the people you helped will really appreciate it, the effort you try to take on the ground. I'd like to encourage everybody to be on mute, please. I can hear some background noises. Peter, it's particularly good to hear the benefit of the use of cash for vulnerable groups and how the disabled, the other groups you mentioned, it's particularly helpful for them given the difficulties and vulnerabilities they face on the daily life. And again, extremely important the point you made on understanding the local context, working with the local partners, looking at the market, of course, the government, the central level, at the regional level, and try to bring it all together in a way that fits the particular situation on the ground. We are already over 45 minutes since we started this webinar, and this is the time actually I would like to start taking in questions from the caller. I would also like to move actually out to our next presenter, Tim Waite. Tim is the Senior Livelihood and Disaster Resilience Advisor working with the DFID, the UK government, and is joining us from London. Tim, Peter was talking about some of the best practices and the feedback that the people we've been trying to help have given on the use of cash. And actually, this brings me to a multi-partner report that the UK government funded that just came out, has just been released, and actually we will provide the link downloading the report right away as a chat box. And this report actually gives some of these best practices on the ground. So, Peter, will be very helpful. First of all, the question that we have is, you as a donor, as DFID, how do you view cash? Is it something you encourage? Are there any special funds available for it? What message would you like to give to field operations? And I can see we have 43 countries at this moment with over 100 participants joining this call live. They would really appreciate to hear your point of view from DFID, but I also know that many other donors are also moving to the same direction. Tim, over to you.
Okay, thank you very much, Panos. Yes, this is Tim Waite in London calling. From a donor perspective, I can talk to DFID specifically, and the message is that we are very pro-cash as a response to humanitarian disasters. Over the past 4 years, I would say, we have been putting together, compiling the evidence. We did a piece of research and evidence looking at the value for money differences between cash, vouchers and food aid. And the evidence is very, very compelling. So we know cash assistance works in most contexts. The evidence is in place, it's preferred, it's cheaper, and it puts people at the center of a response. I mean, this is coming out of this webinar already. However, taking that into consideration, I mean, why isn't cash being used more normally as a sort of one of the modalities put against tarpaulins, food aid, other in-kind and vouchers? Our feeling when we put the inputting the panel together was it was more about the political, institutional mandates. The cluster system doesn't fit well with cash. There's a lot of talk about coordination. I think it needs to be integrated and embedded within. And the links between different actors, for example, private sector. And I think also there's a sort of cultural mindset that cash is scary. So the panel was really investigating how the system can better support cash and how cash can promote flexibility and, most importantly for us, putting the beneficiaries at the center of response. And how can the delivery of cash be transformed so it can be scaled up and it can be done to scale, and the same sort of way that we do food aid and food aid pipelines. So the cash panel met 3 or 4 times. There were very lively discussions, and the panel report was released about 3 weeks ago. The findings of the report, the recommendations, are really going to be guiding much of our policy moving forward, I think. The panel is calling for more multi-sector cash, and it is putting out the challenge that donors and agencies should be asking the question, why not cash, and if not now, then when? So it could be very appropriate in the first 2 or 3 weeks of an earthquake response, like in Nepal, to get food in, to get tarpaulins in, but at which point can you switch it? And also in the Nepal context, why not do what we're calling hybrids, where you are actually sending out your tarpaulin and you're putting, I don't know, strapping an envelope of cash onto that so that people can use that cash when the markets are functioning and everything's gone back to normal. Cash and preparedness is coming out as a very big story. We do preparedness for warehouses, for food pipelines, for other in-kind goods. What would preparedness in cash look like, and how would it be folded into contingency planning? In order to get the efficiency of cash, I think it's very important that we do use local systems. We do use systems such as social protection programs where they exist. We use local money distribution points. In Somalia, we are using the Hawala and piggybacking on money transfer agencies. So sometimes you need to think out of the box a bit on this. I mean, my other job is working on disaster resilience, and cash is a good link with development, and it has other benefits such as financial inclusion. On the panel, we had private sector partners, financial providers, and innovation, big thinkers around these sorts of issues. And we do feel the private sector isn't as involved as it could be to deliver, so that we as agencies aren't trying to do this. I don't think that NGOs should be, the world's experts at delivering cash. There are already experts out there. Regarding cash and fraud and corruption, we've done a study, and digital cash, e-payments, not only for financial inclusion, but it's also a much safer way and a less fraudulent way of moving transfers. And even in conflict situations such as Somalia, there is evidence that there's been some very good experience of moving money where food aid can't be moved to. Okay, running through these a little bit quickly now. I think that our big ask is that we go to scale. We do large-scale, coherent programming. We make better use of markets. We put out tenders competitively, and you're not going to get the efficiency and value for money benefits from cash unless you go to scale. This is coming out in the Lebanon studies where numerous, I think 20 or 30 NGOs were doing cash for different objectives. They were all doing it in different ways, using different cards. How can you get one platform? How can you get one targeting criteria? How can you get 1 or 2 different delivery modalities? And how can you spread it out as we can spread out in-kind aid? I think another one, the final one I'll talk to isn't only about cash, but it's how to finance delivery of cash separately to the assessment, targeting, M&E, and protection, and opens up to the market. So I feel that this, our assessments, our targeting should be non-political, should not be around sectors. It should be around vulnerability and basic needs. Okay, so yes, we've been running a program on preparedness actually with the UN agencies to try and get some of this preparedness thinking in. I think my final slide is going to be around, no, actually the next one after that, that's the preparedness program that we're doing, which is $60 million. Key messages, I would say. We are saying that cash is not a panacea. We are saying that there will still be requirements for other types of support in emergencies, for example, in nutrition, in health systems. This is the big story coming out of Ebola, obviously. But there is evidence that there could be a radical scale-up. We're not setting a target. The panel decided not to set a target. But our sense is that depending on the context, you could go to 30, 40 or 50%. Why not? In-kind and vouchers would then fill the gaps. So we will be asking the why not cash, if not now, when? And then we will be testing what needs to change to deliver this ambition. It's around political leadership. I've talked about culture change in the humanitarian system, more use of private sector, focus on market responses, maybe moving from a humanitarian system to a broader ecosystem, more use of national governments, for example, and focus on more and better donor coordination, but I think more importantly is donor alignment. So donors are speaking with one voice and not giving mixed messages to agencies. Thank you very much, Panos.
Well, thank you, Tim. Really, thank you for covering it from so many perspectives. The donor voice, the donor support, the messages you gave are really crucial for all us humanitarians in the various operations when we consider the modes of response and really the use of cash. I would really like to encourage everybody to go through the report, which I've just downloaded on the chat box. You see the link, we have it at our website as well. It gives very useful evidence, leads, direction to really be considered by operations. Of course, contextualizing within your own context, as several of the speakers have already outlined. So really it is tremendous value for us humanitarian practitioners as we consider options in terms of how to go. I'm taking now another question that one of the callers has sent. Actually, Hannah Lee has sent a question, and Rosie, I would like to direct this question to you. And the question is, how similar or different is cash in development and in humanitarian operations? What is the evidence of the use of it in both contexts, humanitarian and development? Rosie, over to you.
Thanks, Panos. And I think actually this is something that Tim has spoken to slightly in his presentation, but we're seeing a lot, in terms of the principles and design around cash transfers and some of the things we talked about around needs analysis and the operational challenges and things. These are very similar in terms of how you would operationalize and design your cash transfer, whether it's development or humanitarian. There tends to be quite a lot of research on both sides of this sort of artificial divide, if you like, but we're working within the calc to see how we can link those up. Longer term, you would typically, there might be more investment in terms of linking up with national systems and something that is sort of more systematic and associated with those sorts of programs that we can do with more time, so a lot more join up and partnerships. But essentially, they should be in principle not very different, and there's certainly a lot that we could learn from keeping that dialogue much more open.
Thank you. I'd like to move to the next question, and Jamie, one of the callers, Jane, sent a message saying, in the Nepal earthquake response, did the emphasis on cash encourage the government to take responsibility or perhaps to avoid some of the responsibilities in terms of delivering at the district level? How would the use of cash, basically the interaction or responsibility with the government, did it have any impact? Jamie, over to you.
Yeah, Panos, thanks. I think, as I mentioned in my presentation, one of the issues that we faced was actually the dialogue with the government on how cash should be used. The government had their own initiative in terms of giving cash as compensation to the affected populations Meanwhile, NGOs and others in the districts affected were trying to work through the local district officer to actually use cash in a more targeted fashion. There was some friction between, I think, national and district level in terms of how they interpreted the directions and directives that came from national level. As a result of that, there was some delays and some confusion over how cash should be used. And then there was the whole notion of trying to calibrate what the government was giving to an affected person or family versus the NGOs, and then trying to come up with a system which would allow lists that were there for beneficiaries to be consistent. One of the issues we faced in the affected districts was the fact that some lists were all-encompassing, whereas the approach that we had as Humanitarians was to target, and as a result of that, there were some complications. Over to you.
Thank you. I'd like to take the next question actually to Kathmandu and ask Peter. Peter, one of the callers has sent a message, really it's a bit of a spicy, provocative question, saying, can we just simply say do more cash? Really, is that responsible? How does the local market functionality perhaps in particular if there is a limited or a low market functionality, how can this affect the use of cash? And related to that, there's also another caller who is saying, how does the use of cash affect the local market? Can it really could it lead into inflation at the market? So Peter, what are your thoughts? Over to you.
Yeah, I think our experience would be that there is a place for, clearly there is a place for cash, and probably a bigger place for cash in the response, but not to the exclusion of other things, because it will depend on the local circumstance and indeed the basic requirement that the goods that you want people to be able to purchase are actually available. And I know that ourselves and many other agencies were doing local market assessments to find out if there was indeed materials, goods available. And some of the UN agencies, probably WFP primarily, were also doing the same. And I think we benefited a lot from having that information to hand. But I think we could also ask the question that the same challenge would apply if we didn't do cash and wanted to distribute commodities. What if the market isn't there for those items? It's still a similar challenge. I think we were fortunate in a sense. It might seem strange to say that. Clearly this was a significant disaster, but it wasn't a catastrophe that many people had been planning for. And a lot of the infrastructure was still up and running. One of the reasons why cash was an option was because the distribution mechanisms were still there. But also a lot of the market actually recovered extremely quickly, if you're talking more like the kind of micro level. And basically that's where most people will get their daily goods anyway. So when it became clear that the market was still functioning, shops were open, stocks were available, actually injecting that cash into the community actually made quite a difference. I think it helped the local markets to recover more quickly. You're putting a resource into the local economy. It helps it to recover quickly. You're giving working capital to small traders. They're able to buy more stock and bring it into the locality more quickly. So there's a huge, I think, number of spin-offs, positive spin-offs, where cash is an appropriate approach, and it does contribute to that broader recovery, assuming the basic infrastructure is still up and running. And we're actually in a position now with some challenges between Nepal and India that there's a restriction on goods coming into the country. Nepal being a landlocked country is very dependent on India for its imports. So actually if the earthquake or a disaster happened now, we'd actually be in a much more difficult position, whether we were distributing cash for purchase of commodity or we're trying to get a hold of commodity on large scale to distribute to the victims of a disaster. But I think cash in this case did make a significant contribution to not only getting the goods in the hands of beneficiaries, but helping the local markets to recover.
Right. Thank you, Peter. Thanks. I'm going to take the next question to Rita. Rita, one of the callers is asking about the impact of cash transfer in addressing protection issues. You talked earlier on about, in particular, the women being the beneficiaries of cash, but how about broader vulnerability and the use of cash in protection? Rita, over to you.
Thank you so much, panos. Yes, actually, you know, when we introduced cash in using mobile phone for the first time, we realized that, and we considered the security issue at first among others. So the main idea was to protect, to provide the security to our people coming to collect the cash, and also to provide the security to the cash that we distribute. So this was the two issues at the beginning. Similarly, like you mentioned, security of people, especially women coming far away to the distribution point, was another issue. Therefore, we considered this issue before we established our distribution point. Then, you know, the recent PDM survey that shows that majority of the people coming from the village to our cash distribution point, that took 1 hour to arrive in the distribution point and go back. So this shows that we consider this issue, especially because 29% cash went to the women's hand, as I presented earlier, because these women were coming with babies. We have so many pictures of that and case story that we collected with these women, because they have issues as a family. They wanted to make sure that cash is at their hand, and they cannot leave their children at home because nobody is there to take care of those children. So what we did is we ensured that somebody will help them to come to our distribution point. We pay for those kind of helpers, supporters, also from our partner organization. And also we established a children's center in each cash distribution point, so that these children are taken care during the women are queuing up. The third thing that we also ensured to provide the support to the women, lactating mothers, elderly, and other vulnerable group that, you know, they are queuing in the first in the row. So therefore, you know, the maximum queuing time for those vulnerable group was maximum 20 minutes. Therefore, we ensure that these people will be treated professionally and at first. We also had established a psychosocial desk, because that was the situation when we distributed cash, was the very painful situation. They were just coming out from the earthquake and so many tremors were still there. So we made sure that these people, you know, these people will be heard in our help desk with psychosocial support staff, so that, you know, we could actually follow up with our psychosocial program later on. And we also established a complaint response mechanism, so that people have opportunity to complain, to complain about our program, how it went, and whether or not we are able to provide the security to the women, to the elderly, to the people coming from the remote location in the new area. So these were really considered, and we brought the bank with us close to the community. So each distribution point was 1 hour far from the community, traveling from the 9th ward. We have 9 ward in one community, one village. So this is how we consider the protection issues in our cash distribution. Over to you, Panos.
Thank you, Rita. Really a very important point to bring there, particularly on use of cash, protection, vulnerabilities, and how to do the right thing in a responsible way. May I ask speakers to be on mute, please? I can hear some background noise. Okay, I'm actually going to go back to Rosie. I understand, Rosie, you want to come back into the conversation to elaborate a little bit further on the last question, which was about markets, inflation, and how the cash is affecting. I'd like actually to ask colleagues who have any last questions to send them in. We have about 20 minutes left to the end of the webinar, and I would also like to ask all speakers to be as brief as possible in your answers, as we have quite a lot of questions in front of us. So, Rosie, over to you.
Great, thanks, Panos. And just on to build on the protection, actually, before I move on briefly to markets, there's a lot of growing evidence around protection in cash now. A lot can be found through the CALP website around safeguarding and protection programming. So I think that's a really useful development. I just wanted to come in on the markets and build on what Peter had said there. I think this is the perception is that markets are static, and I think it's really important consideration for people around cash transfers. You obviously have these questions around can they support cash at the time, but I think we would obviously want to be able to seeing that over time, how our market's changing, and that markets don't only respond, as Peter had alluded to cash transfers. You know, we're really seeing markets as kind of central engines or drivers of recovery in rapid onset, of resilience. You know, they provide where people are selling items, where people are buying. So these are very critical beneficiaries, if you like, of the program. So it's really important to be supporting that. So I just wanted to make that point, that there's also a lot of programming associated with cash transfers that can facilitate this this absorption, if you like, of cash coming in. Thank you.
Thank you, Rosie. I'm now going to move back to Kathmandu and to Jamie. Jamie, one of the callers sent us a question saying, how can we better include the private sector and the financial sector in the humanitarian response? You alluded a little bit, also Tim alluded to that. So what was your Nepal experience with the engagement of the private sector in the humanitarian response, and cash, of course, in particular? Jamie, over to you.
Okay, thanks, Panos. I mean, what we tried to do ourselves was actually, quite quickly after the earthquake, was to have a conversation with a number of groups of big business. We did it through the Chamber of Commerce of Nepal, the national one. We also did the outreach to the district affected areas where they have their own district chambers of commerce, and we had that conversation on them used as a vector for information, also for supplies, and also for coordination as well. But I think if we're going to improve the way we deal with the private sector, we have to engage well beforehand. You know, I think everything, like everything else, is context specific. You know, and here in Nepal, we have very few global and regional private sector actors. In a context where national and private, local private sector actors are very small, if you want to engage in preparedness and risk reduction, you have to be prepared to give something and bring them to the table as well as get something. For example, we'll be working here with the private sector on preparing their own business continuity plans. Our sector, the humanitarian sector, doesn't think it's appropriate to spend resources in capacity building the private sector, but the reality is that without them in this context, like Nepal, the private sector won't support us. We have to ensure that NGOs know what the private sector organisations are, you know, how contacts can be made, you know, and I think it's important that we have a coordinated list of those contacts and we don't overburden them by going in too many numbers. And they themselves, as private sectors, have no interest in our individual organisations and mandates. They just want to know how they can dock in or plug into our work and be complementary or supplementary. So I would say that if we encourage the private sector to play to their strengths, we shouldn't ask them to replicate what we're trying to do or what government's trying to do. And I think understanding the cash distribution may be the last thing that the private sector wants to engage, as it doesn't have the visibility they want. And we have to be prepared to have a very serious and detailed discussion well in advance of a crisis striking. Over to you, Panos.
Thanks, Jim. Jamie, an important role of the private sector, perhaps in some situations underutilized, and indeed seeing how to best engage them in the situations is crucial. I'm actually going to take us all back to London, and I have a question for Tim that one of the callers, as you know, as I can see in front of me, more than half of our listeners at this point are from Africa and the Middle East, and one of them is actually sending a provocative question saying, well, good enough to talking about the Nepal earthquake. How about conflict situations, and how is the use of cash in today's complicated world with the terrorist organizations, with the conflict? Has the study shown at all how the cash has been used in conflict situations? Can use of cash fuel conflict, or being taken by one or the other party in order to manipulate the military or other objectives? So, Tim, what is the study? What are your reflections on use of cash in conflict situations, possibly fueling conflict? Tim, over to you.
Okay, thank you, Panos. Yes, we have been asked this question a few times before, and we have done had a look at the evidence which is out there. I think there's some very interesting evidence coming out of Somalia, and during the 1990s, I used to listen to the World Service and hear stories of whole convoys of trucks being hijacked and moved away. And so I think that any kind of value item moving into a conflict situation can cause problems and can fuel these conflicts. I think the benefit of cash has been and can be that if it's done as e-payments, if it's done by mobile phones, it's pretty much invisible, and you can transfer it to people and nobody knows how much it is, what it is, who it is that's got it. So as with a lot of things, and as Rosie said, a lot of this comes down to program design, really. And I think you have to be very aware of the risks of any modality transfer in these situations. A very quick one on cash and markets. There's a very interesting story that came out of Somalia, that people did market assessments and all the shops were closed, and so they said cash wouldn't work. In actual fact, the reason that the shops were closed and the markets weren't working was because there was no cash. And once the cash distribution was done, it was Adesso and a number of other NGOs, people started trading and things started moving again. So cash can actually open up markets, not close down markets as well. Thank you.
Thank you. Thanks, Tim. I'm actually going to take us now to the next question. And Jamie, we have a question the caller was asking about how can we realistically do a multi-sector cash given the rigidity of the humanitarian system with agency mandates and agencies, while we're really trying here to work across all sectors. Has it really realistically worked in the Nepal conflict after earthquake situation? Jamie, over to you.
Okay, thanks, Panos. I think it worked quite well here because I think there was a good collaboration across clusters and inside clusters. We had established a response for floods, as early response preparedness systems training, so that was put us in good stead. But in terms of the actual system, the humanitarian the system as it is right now, I don't think it's comfortable with cash transfers. I think you mentioned some of the issues there, the interest in the mandates of some of the agencies. And I think to reflect on what Tim said earlier, we cannot allow donors to sit by and give us different messages. So the donor alignment on this to me is so crucial. They can't be telling us in the executive boards one thing, telling it something else in the capital, and then saying something else on the ground. So I think that we have to have some consistency from that. The change that will come about will only come through better leadership at the humanitarian country team and the ICC, the intercluster coordination. And I think the role of the cash coordination groups must be visibly supported by the HC and the OCHA. And we have to use it to influence inside every single cluster that's relevant for cash transferring. And it should be targeted based on where the influence is most relevant. The worry would be we try to make it cover everything and multi-sector, and it's not going to do that. There are, as was mentioned in previous presentations, some sectors don't lend themselves to cash transfers. I think the information management systems we use for coordination support must be modified in a better way to support multi-sectoral cash assistance and make sure it's captured, make sure that the clusters and the sectors have specific cash assistance reporting, which they don't have at the moment. And I think that we have to use that to talk about the impact of cash. And there's obviously a preparedness issue there as well, and we're trying to, at the moment right now, patch together based on incomplete data, and that's not a satisfactory situation to be there. And I think that ultimately the humanitarian coordinator, the chairs of the intercluster groups, and the clusters themselves, as well as the OCHA heads of office, have to be much more confident, much more comfortable regarding cash modalities. Otherwise, they're not going to be the advocates and the champions they have to be. I'll leave it there. Over to you, Panos.
Thanks, Jeremy. Indeed, understanding the modalities gives that confidence to be able to advocate and really bring that change, that mindset change, into our humanitarian world system in order to look into efficiency results, and most importantly, to be closer to what the affected people are asking us to do and what is most helpful for them. I'm actually going to take the next question to Peter. And Peter, one of the callers is asking about the cash transfers and security. The question is it really endangering humanitarian workers when they have to have the cash, in particular if one is operating in dangerous areas? What's your feedback on cash and security in high-risk areas? Peter, over to you.
Thanks, Panos. Yeah, I think that's obviously a very important question. I think to some extent we're quite fortunate at the moment in Nepal in that we're not in it's not the kind of environment where there are such concerns on that issue as you might find in a conflict zone or a country where there might be a high crime rate and where you would be much more vulnerable and your staff would be much more vulnerable. But clearly you have to take sufficient steps to ensure that you're not exposing your staff to risk, that you're developing a kind of standard operating procedures that mitigates risk, and you have processes in place to manage any risk that might be there. So that's all about knowing the local environment, arranging some security at distribution points from the local authority, as was the case that we experienced, and I'm sure other agencies did as well. Being very sensible about how you actually transfer the cash around, all the usual process of kind of varying your timings and different routes, and making sure that key information is kept confidential. You clearly must bring your staff and your partners into that conversation. You have to write it all up so that people know what the rules are and what they're supposed to stick to. But I'd say possibly compared with many other places at the moment, Nepal was a relatively easier place to deal with that particular situation. We didn't ourselves experience any major problems in that area, and I'm not sure if anyone else did either. It was very, very quiet in that regard, so I think we were extremely fortunate in this case. But obviously that would be a concern anywhere, and especially where peace is not there on the ground, or as I said, there's a higher kind of crime rate and a greater risk that you would have to deal with.
Thank you, Peter. Indeed, it's fortunate to be on that safe environment and great, because that really, of course, makes it much more enabling. Colleagues, we have about 7 or 8 minutes left to the end of this webinar. I'd like to point out to the polling that has gone out. If you press on the top right-hand side, there is actually a few questions while I will be asking the next speaker for an answer to a question. We are really asking all of you to take a minute and just provide us some feedback on how you found this webinar. Your point of view is really crucial to us as we plan for more webinars, and would like to hear what you like, what was useful, and your feedback on this particular one. Jamie, I'm going to come back to you with one more question we have for you, and the question is really, one of the callers is asking, was the cash working group in Nepal, was it able to standardize the monitoring and evaluation indicators across organizations and the clusters so that the outcome could be measured for the system? So it's really on M&E, the question around the cash working group in Nepal and your experience. Jamie, over to you.
Yeah, thanks, Panos. No, in fact, we didn't. I mean, the cash coordination group developed a post-distribution monitoring set of monitoring indicators, and they've been used in many of the multi-purpose grant distribution partners. But because of delays in implementation of these grants, many of the agencies are still trying to gather the data from these. So we have to do much more analysis, and it will need to be conducted in the coming months to get a full picture of where we are. I think some other clusters have developed other sets of indicators, not all of which have been coordinated with the cash coordination group, and I think that's something we have to recognise and we have to try and avoid in the future. And I think in the future this is an area we'd have to improve to show that this cash coordination group has the strength, the support, and the leadership and the leverage to advocate for scale up and ensure that good cash related indicators are embedded into all of the sectors as a monitoring output. So over to you, Panos.
Thank you. Thanks, Jamie. I'm going to take the next question to Rita in Kathmandu. Rita, the role of the local communities, we all know, is really crucial in all aspects of the operation. But one of the questions I have is, how can we better prepare the local communities to ensure that cash programming really is best utilized, making the most of that richness of knowledge and understanding that the local communities have more than any of us when we go to operate in the area. So, Rita, what is your reflection on how to better prepare? Over to you.
Hi, thanks Panos, thanks again. Yes, we are the part of the ACT Alliance, and we actually are the HAP members as well in Nepal. Globally, we are the HAP members, so we definitely consider the participation of the community is the key in cash transfer program as well. Actually, for that, we prepared the community very well. We met them, we visited with our volunteers and staff, together with the local political mechanism. Because one thing in Nepal is, when there is no existing government, local government bodies, it is all what we need to do at the community level is to work with the local political mechanism. It's a multi-party political mechanism. So therefore, in any of such work in the village, we have to work with them. This was very much considered, and any visit that we made in the community was together with this political mechanism. So we are not targeting one party or something like this. Therefore, that was quite done, and what we did is we wanted to inform the community as much as possible as well on the objective of the cash transfer. Before we even decided the cash transfer, we involved already the community in the market survey. So they knew that something is coming up, but we wanted to inform them as much as possible through our banners and also the info sheet about what is cash transfer, what is going to be like, what it will look like. And this was also done through the focus group discussion, because sometimes it was impossible due to the rubbles on the street, on the village, and so on. It was initial days, so it was tough. However, we did consultate the community and made sure that we involved them throughout our program. And another thing that we were able to do was involving them in, even to talking with the other community that we are not able to cover from the first distribution, because it was all targeting in the beginning, because we had limited resources, we could not go to the other communities. So how to deal with this problem, because we had to cross one village to go to the village that we had selected. So this was a concern. There also we involved the community to handle the situation, to make sure that this community is much more affected than the other communities. So this is how we make sure that we had the community participation in our decision-making process, and their voice was heard. Thank you so much. Over to you, Panos.
Thank you, Rita. That was really a very important point you made with regards to the local communities. Very much appreciated. Actually, we have about 2 minutes left to the end of this webinar. I'm going to take us back to London. And Tim, one of the callers has asked about the forthcoming World Humanitarian Summit, which is happening next spring. The question is really, do you see the World Humanitarian Summit as an opportunity to challenge the humanitarian coordination system and really to see how to bring together this multi-sector issues in order to ensure that we're not just staying into our very specific cluster or agency mandate? So what are your reflections? And I really want to make sure everybody is on mute so I can get some background. So Tim, over to you.
Okay, thank you very much, Panos. Yes, the idea when we were designing the cash panel was that the cash panel would actually feed into the World Humanitarian Summit process. It started off in the innovation wing, but we very quickly realized that it really is, the multi-sector nature is a challenge to the current system. So it has been figuring very much in the sort of transformational elements and discussions of the World Humanitarian Summit. So the panel report was actually submitted before the deadline. It went to the ERC, received a copy, and we've also been feeding into the high-level panel on humanitarian financing. So cash can almost be described as disruptive or transformative, depending on which side of the fence you're sitting on. And we think that the nature of cash is something that can leverage some of this change. It can, it gives the opportunity to have a look at the cluster system and see whether it really is fit for purpose for delivering cash. And if not, and then what other sort of modalities, what other sort of systems or what other ecosystems, as we call them, would be able to do this. So I know that there's also a private sector discussion going on in the build up to the WHS, and we've been sort of linking in with that one. Finally, at the global consultations next week, there is actually a cash panel presentation, which is going to have, I think, Jan Egeland, who was on our cash panel, representing. So I think we're building up a sort of a head of steam, and I think now it really is for donors, agencies, private sector, governments to come together to align to give that sort of scale up. And I think we're in a good place at the moment. I feel optimistic, shall we say. Thank you very much.
Thank you, Tim. It's good to be optimistic, and indeed the World Humanitarian Summit is really looking for the way forward, taking all this knowledge, these best practices, as we heard from colleagues in the field, and really seeing within our humanitarian system and operations how to take it forward in the best possible way to ensure better efficiency and results. Colleagues, I'm afraid we've run out of time. I really would like, first of all, to ask you all to, if you haven't done so, to take a minute to give us your feedback on how you found this webinar. I would like to say really a warm thank you to all our panelists. I want to name them all: Rosie Jackson with the Cash Learning Partnership, joining us from London; Jamie McColdridge, Humanitarian Coordinator, joining us from Kathmandu; Rita Dekar, working with the Danish Church Aid, also joining us from Kathmandu; Peter Magici, working with Health Aid International, also from Kathmandu; and Tim Waite, joining us from London, working with DFID. I want to particularly also thank all the listeners, all of you who stayed with us through this webinar. We hope you find it useful. We hope at the end of it you came up with some practical tips, some better ideas from listening from practitioners and best examples in the field in terms of the cash. Really, thank you all for staying with us, and would like to wish you all the very best. So goodbye from me in Geneva.